Other classification of drugs used in the treatment of mental illness can be also be classified into two in terms of the major tranquilizers, or let me call it the antipsychotics. We have what we call typical and atypical antipsychotics. This typical and atypical antipsychotics is a classification of these drugs based on their generation. Then we have typical, you can call it classical antipsychotic or old generation antipsychotic or first generation antipsychotic. These drugs are drugs that have a high effect in the neuroleptic pathway rather on D2 receptor pathway. So the effect it function in the D2 receptor pathway is that effect that it blocks that D2. And when D2 is being blocked, it blocks the D2 in excesses, which lead to extrapyramidal side effects. So this aspect of drugs, one, they are low cost, they can easily be accessible, and they have high side effects. Then, well, before prescription of this particular drug, or before prescribing this drug to any patient, you first of all evaluate the patient's background because the drug is expensive. Remember, high cost. So, but sorry, the drug is less expensive. Sorry, low cost. So the low cost of it is why the background is being considered. So it is important because the price is low, given to the less class of persons. Not that people that are of high class cannot take these drugs, because it can also be used as first line of treatment of every mental illness. Then, if that individual is reacting to it because it have an easy way of blocking the D2 receptor, possibly causing respiratory side effects. So we now take the individual to the other aspect of drugs, which is called the atypical. Then the typical drugs is basically used because it is the first line of medication in psychiatric illness. So it does not matter again in your family background. It may be of high class or higher class or upper class, but this is the drug that is okay in your system. We give it to you, and if it is not okay in your system, we swap. But before we swap, we take part, we reduce it until we withdraw it from that individual before the individual will go into conversion or drug withdrawal effects. Then we now talk about drugs that fall in this class, that basically the normal CPZ, chlorpromazine, olagatil, can talk about stelazine, then talk about even modicate, even the normal episode. These drugs are all drugs found as typical of first generation antipsychotic. Then second generation antipsychotic are drugs like, they does not only they do not only block only the D2 receptor, they also block the serotonergic pathway. Then you see that the serotonin pathway will also be blocked, the dopamine pathway will also be blocked. Then also going directly trying to modulate the alpha adrenergic pathway also. So you see that the individual, the dog is trying to checkmate almost all the neurotransmitters in the system, all that will possibly lead to extrapyramidal side effects. So it's indirectly, even going indirectly, affecting or trying to modulate the function of the acetylcholine. Then these drugs are very good because the individual taking it does not have more side effects, highly expensive in terms of price. It is well packaged, hardly come in canteen, it comes in packs. So these particular drugs are very good when giving it to a patient. So this classification can also be used as a clarification of antipsychotics, which is one of the drugs used in the treatment of mental illness. As time goes on, we are going to talk about the drugs that are found in this, which I may highlight few. When we talk about the phenothiazine, in terms of this class of antipsychotic using the phenothiazinic acid, they say these are the oldest in the category used in the treatment of psychiatric disorders. They have high side effect profile and should be administered under careful supervision. Just as I said before, the example of the drugs that can be found under this can be chlorpromazine. Then these drugs can be given orally or intramuscularly. Remember, the dosage comes from 2500, can give the individual within 100 milligram, 200 milligram divided doses. So it helps. The indication is the treatment of schizophrenia, aggressiveness, destructiveness, severe nausea and vomiting, agitation, depression. We talk about hiccup, vagrant psychosis also can also be used to treat these drugs. This drug is highly contraindicated for those that have liver impairment and allergy. We have side effects. There is allergic reaction that if you react to this drug, you withdraw it from those people. Remember what I said before. Then we have side effect. We have what we call photosensitivity. We have tardive dyskinesia. We have blood dysplasia. We have orthostatic hypotension. We have tremor. We have nausea, skin reaction or rashes. We have salivation. We have protrusion of tongue. Some of these are good as except another side effects. Then we have nurse's responsibility. Make sure as a nurse, remember, you encourage patients to drink plenty of water to prevent dry mouth because this drug can lead to dry mouth. Avoid direct exposure to sunlight after taking this drug. Patients should rise slowly from bed because of the orthostatic hypertension. Then monitor side effects and make sure you record. Watch if patients have taken these drugs. Very soon we are going to talk about nurses' responsibility in a full background. Then let's talk about trifloperacin, which is telazine. This drug is also used in the treatment of schizophrenia, treatment of hallucinations, severe vomiting, panic anxiety, psychosomatic disorders. Then it comes orally. I also see it hardly found intramuscularly, but it's in intramuscular aspect. But basically, me, I've seen more of the oral aspect of it. Then the dosage comes in 5 milligram to 30 milligram divided doses. It depends on how you're taking it based on the level of the individual's condition. It is contraindicated in liver impairment when you have that unconsciousness. We have when patient is in coma, allergic reaction, bone marrow, depression or blood dysplasias. We have side effects like dizziness, skin rashes. We have what we call dry mouth, blood vision, amenorrhea, muscle weakness, vertigo, and every other extrapyramidal side effects. The nursery is just as mentioned in the chlorpromazine. We have another of these drug called thyroidazine, which is also called Melare. Then the Melare is given orally only. It comes in 50 to 100 milligram. The dosage is what I want to tell you. If you are given an antibiotic drug, make sure you monitor the dose because it has a high profile of drug reaction. Then it is indicated in psychotic disorder and also in psychosis, even behavioral disorders in children. Then I want to talk about the polyphenol. The polyphenol, there are some drugs that fall in the polyphenol which I mentioned is haloperidol, hydrochloride, which is called Sereness or Hadol. The route is orally or intramuscularly. Yes, can still give the individual intravenously, but I will not advise that for now. The dosage comes from that of I've seen tab form of it comes in 5, even injection 5 milligram. We can give it 5 to 15 milligram is very dose. It depends on what is wrong with the individuals and how serious it is. This drug block the postsynaptic dopamine receptor in the hypothalamus. limbic system and the reticular formation. So that is why you see it is very, very active in function, which I said before. But make sure you give this drug with carefulness. It is also used in treatment of mania, paranoia, schizophrenia, anxiety, and tension, infantile autism, and every other disorders that other drug can also take, can also use or be treated with. So they can also be contraindicated to comatose state. We have senior depression, we have Parkinson disease, lesion of the basal ganglia, pregnancy and lactation. Children less than 3 cannot take it. Hypersensitivity and coma is not advised to take it. Elderly person can also be affected when take. So it is contraindicated for them. So side effects can also be insomnia, can be dizziness, headache, can be constipation, nausea, tachycardia, and every other extra side effect. Then we have thousand times, which is also a group of it. Then remember nursing responsibilities are the same as that of levity or copomazine. We have what called thousand times. Thousand times is called phenazine decanate and clopizole, which is flanzole, constituents like flopentizole, which is called the pizole, constituents like clofenazine, ethanol, which is called Moditen. Then the fluofinazine endocanate is the normal one that we usually you call the Modicate or MC. For blind, we call it 25 milligram. We have the pizzo aspect of it, which is the pizzo. Pizzo is plus flanazole. Sorry, the pizzo is called fluofinazole. Okay, fluopentazole or the pizzo, which comes basically 20 and 40 milligrams, just as I said before. Then the 20 milligram comes in 1 minute, the 40 milligram comes in 2 minutes. But you can give it to individual just to modulate the individual. So when the individual is being withdrawn from other drug, you can use this drug as a maintenance drugs. Then the side effects, contraindication is the same as every other atypical, every other major antipsychotic or any other first generation antipsychotic. So remember that there is reasons. Okay, remember that the reasons for giving these drugs will also be outlined, which I'm going to make sure that I give you in the next video. But remember that these are the classification of major antipsychotic and the chemical classification of it, where I now compounded it. From there, I also talk about the classification based on the major and minor, then which is functional classification, then talk about atypical and the typical antipsychotic. So the atypical antipsychotic will be discussed after discussing reason for giving long-term medication or long-acting medication. These drugs that are called the long-acting medication or maintenance drugs are basically found in times, which I will discuss as a brief topics. Thank you.